Good afternoon, everyone. We'll get started. Welcome to the second online version of the Collective for Gender Plus in Research seminar series. As we reimagine our gatherings in light of COVID-19, my name is Dr. J.P. Catungal. I'm an assistant professor with the Institute for Gender, Race, Sexuality, and Social Justice. And it is my pleasure to be hosting this teach-in and moderating the Q&A discussion later. We begin by acknowledging that the University of British Columbia, as the host institution for this event, sits on the traditional, ancestral, and unceded territory of the Musqueam people. As we dialogue today about knowledge, justice, and data, we should keep in mind that settler colonialism and the racial and colonial violence of white supremacy that is foundational to many institutions, including both educational institutions and health institutions, is part of the context within which we are having this conversation. It is a really important context. We recognize that meeting in this virtual space means that all of you might currently be on different Indigenous territories, and we welcome you to self-identify where you are located in the chat box at the bottom of your screens. To help facilitate this, we invite you to take a moment and head to www.natives-land.ca, which is posted in the chat box. Simply type the name of the city or town in which you are located and explore the various territories, languages, and treaties relevant to the land on which you sit. Maybe explore is not quite the right word given what we are talking about here, but to learn more about the territories, languages, and treaties that you are, on which you are located and therefore in a relationship with. Just a bit of background about the Collective for Gender Plus in Research. The Collective works to promote a community for rich dialogue in which gender and intersecting in its intersections, including but not limited to race, class, sexuality, and ability, are considered when conducting research. The Collective focuses on capacity building and providing the tools researchers need to consider and utilize a gender plus lens. Emerging out of conversations surrounding UBC's Women Deliver 2019 mobilizations, the Collective builds on networks and connections from that initiative. Students, researchers, and interested community members in all their variations are welcome to join us. For today's teach-in, we aim to consider and discuss gender plus considerations during COVID-19. Speakers on the panel here today will attend to the various ways data can be mobilized by and for communities during the pandemic, how communities are responding to the need for intersectional data collection and analysis, and what some of the vulnerabilities might be for specific individuals and communities in the push to collect and disseminate health data. This seminar is organized as a teach-in, in which each panelist will speak for 5 to 7 minutes on a topic relevant to Gender Plus, COVID-19, and data. And then a Q&A will follow that I am hosting at the end. Written questions can be submitted via the Q&A function at the bottom of your screen. If you see a question that you like or is similar to one that you want to ask, please upvote. We will monitor the Q&A window and post questions using attendees' first names only. If you would like to pose a question to a specific panelist, please indicate this in your question. Please note that this webinar and the following Q&A will be recorded. By joining the Zoom presentation, we are not asking you to use your camera or microphone to participate in the Q&A. After the presentation, the recording will be uploaded publicly to the Gender Plus Collective website and YouTube. A link will also be sent to today's attendees. The recording will not include attendees' names. Now on to the show. On April 30th of this year, I released an open letter written collaboratively with RJ Aquino of the Tulayan Filipinx Diaspora Society, calling on the BC government and the Ministry of Health to collect race and ethnicity data on COVID-19. We approached our open call from our lived experiences and embeddedness in local Filipinx Canadian communities. our situated knowledges as diasporic Filipinx, and our engagement with Filipinx Canadian studies. From that perspective, we know that members of our communities are disproportionately found in so-called essential services, services like long-term caregiving, home care, nursing, and the food, manufacturing, grocery, and customer service industries. We understand these racialized patterns of overrepresentation in these sectors to be the effect of immigration laws and policies and of racially inflected and indeed in many ways racist capitalist economies. But we have no data to know whether such overrepresentation in these sectors is translating to heightened risk for COVID-19 exposures, infections, or deaths. Well, we kept hearing from our communities and from the more general public that COVID-19 does not discriminate. We know from experience in other jurisdictions where such data is available, say in the UK, and in the US, that diasporic Filipinx communities are disproportionately exposed to COVID-19. And indeed, in many jurisdictions with access to such data, Indigenous, Black, and people of color communities bear the disproportionate brunt of COVID-19, not only on their individual bodies, but also on their social, cultural, and economic systems. RJ Aquino and I were thus not alone in calling for such data, emphasizing, as do others, that data collection and use must be done, but must be done ethically, responsibly, and with meaningful and culturally appropriate involvement and stewardship from marginalized communities. Today, we will hear from several panelists about their work in this area. I will introduce them with a short bio all at once. They will speak alphabetically by last name, and prior to each of their turns, I will introduce them more fully. I am joined today by Dr. Faithe, who is a CLIR postdoctoral fellow in African and African American data curation at Purdue University, and also the assistant director of COVID Black, a Black digital humanities collective and task force on Black health data and discourse. The next speaker is Dr. June Francis, who is an associate professor of marketing at SFU, director of SFU's Institute for Diaspora Research and Engagement, and co-chair of Hogan's Alley Society. That's Simon Fraser University. Courtney Skye is our third speaker. Courtney is a research fellow with the Yellowhead Institute, a First Nations-led governance think tank at Ryerson University. Our final speaker is Kevonnie Whyte, who is a business analyst with the Vancouver Coastal Health and also an organizer with the Black in BC Mutual Aid Collective. Kevonnie sits on the City of Vancouver's Racial and Ethnocultural Advisory Committee. We will begin with Dr. Faithe. As I mentioned, Dr. Day is a CLIR postdoctoral fellow and the assistant director of COVID Black. Her interests include the ethics and critique of data and data justice, as well as community-based and intersectional data. Dr. Day's research specifically focuses on Black, queer, and femme digital praxis and how people perform their identities through the study of online comments and video sharing platform. Please go ahead, Dr. Day.
Okay, thank you for the introduction. I was reviewing actually the research questions for the Citizen Science and Community-Based Research Initiative. So I've essentially kind of crafted my responses to address those questions through my own research and affiliations. So first, as the assistant director of COVID Black, which is kind of a newly stated organization and both a collective and a task force on Black health and data. Feel free to follow us on Twitter for more information. We've been thinking a lot about working on illuminating the relationship between health information, institutions of healthcare, and higher learning, as well as Black communities, specifically by centering Black research and researchers, as well as individuals who understand community organizing and participatory design, our collective is really incorporating Black history and theoretical frameworks like intersectionality and critical race theory to truly unpack the multiple intersecting relationships between society, politics, identity, and data. And being someone who lives in the United States, there has been a lot of concern around the collection of data on COVID-19 within communities of color. And I would say that beginning in about March of 2020, there was little data being publicly shared on race and ethnicity. It was not required by all states to release their data, which meant that there were many rumors and misinformation circulating about COVID-19, especially in Black communities. One search rumor being that Black people were actually immune to the virus itself. And now that we have so much race ethnicity data, it's apparent that many of those initial beliefs are false. So in my research and work, I think it's important to not only speak to how data is collected and analyzed, but also how information and data spreads or doesn't spread through social networks and communities. With that being said, one of the first actions from COVID Black was drafting a letter for academics and community members to send to their local healthcare and academic institutions to collect race and ethnicity data on COVID-19. Following that letter and many other letters and calls to action from various organizations, we actually now have seen the collection of race and gender data from most states. And I think most recently, we're starting to see age group data filter in. However, we still need more data analyses on how race, gender, and many other identities work together in the health outcomes that we are seeing right now. Therefore, a couple of weeks ago, we drafted another letter which specifically spoke to intersectional data, or what some have called heterogeneous data. And with the intersectional data letter, my main concern was responding to the Trump administration's consistent push to equate sex with gender and the potential discrimination that comes with that in healthcare institutions, as well as the inaccuracies in data which that creates. Especially most recently, during this week, the White House Coronavirus Task Force has mandated that healthcare institutions send their data to a federal database before publicly sharing it. And I am more concerned now about missing data in that sense than I was in March, especially when it comes to how COVID-19 is affecting Black, queer, and trans communities. Also, how data will be used or not used to make decisions about travel and reopening. Specifically, data-driven decision-making around and after COVID-19, when it comes to health data collection and contact tracing is something that I have a lot of speculations about. While contact tracing is being framed as a necessity, it also brings with it a lot of concerns around surveillance and health data privacy, especially as we are pushed to return to business as normal. We need transparency in how our health data is being shared and tracked, or what we are being expected to give up in terms of sharing information on our health and wellness moving forward. And especially pertains to the type of data being collected, especially from employers about temperature checks, COVID-19 testing, et cetera, and how the sharing of that information and data potentially constitutes many issues with privacy and unique concerns for specific communities, especially as we don't know where this data goes or how it will be used after this time. And I think we can simply look to all of the research and organizing on disability justice and know that this data can make a lot of people even more vulnerable to discrimination. Also, we don't know if and how our data is being sold and to whom. With that being said, what I'm working on right now is creating resources for Black community members about the news and social media, health information and data. Currently, I'm writing a booklet where I'm thinking through the concept of Black living data, because I think that data on death and mortality rates have become incredibly commonplace right now. And I want to think and write more about what it means to engage communities through data that doesn't come from outside the community, like healthcare institutions or the government, but actually educating people about becoming creators and curators of their own data and personal archives. And so specifically through writing about things like data discernment, I want different Black community members to actually feel empowered to sort of counter the spread of disinformations and the rumors that we see online, especially within offline and online social networks, so that if people do see rumors or potentially sketchy graphs, that they can understand that information and be able to say something about it or mobilize against it. And so one example of this is I have a section in my booklet that walks through simple data literacy skills, as well as how to engage with information and data online. And a part of my work with COVID Black is working on videos to actually get that information out to more people. Another exercise that I've developed is what it means to create a data diary and to journal about your media and information consumption, especially during this time. As someone with a background in communication, I think COVID-19 has really illuminated to me that while we talk a lot about media effects, within kind of the realm of what I study, we don't talk enough about data effects and the role that the daily sort of creation and consumption of information and data on things like death, trauma, and systemic inequality, is not great for communities who are also kind of living the reality of that data and discourse every day. And so these are just kind of some of the things I've been working through, and I think that speaks to a lot of the great work this organization is doing, and I look forward to the other presentations and discussion. Thank you.
Thank you very much, Dr. Day. Our next speaker is Dr. June Francis, who, as I mentioned, is an associate professor of marketing, and is the co-founder of the Colaboratorio project that work to strengthen cross-sector collaboration, learning, and innovation for more inclusive, resilient solutions in governance, policies, and industry practice. Dr. Francis is also director of the Institute for Diaspora Research and Engagement at Simon Fraser University. The Institute's mandate is to strengthen the links between scholarly research, policy, and practice related to multicultural and diaspora communities and their role in building innovative, sustainable, and inclusive initiatives. Please go ahead, Dr. Francis.
Thank you so very much. Let me get this up. Okay. So I too appreciate being here, and thank you very much for including us in this panel. I think it's extremely important. I will talk a little bit about the context in Canada, which is a little different from the context in the United States. As early as the beginning of April, I'm just showing you some of the things that happened in Canada, and our concern around, our essential concern in Canada is the lack of race-based data. And I mean at the most fundamental level. And I'm going to argue that this has been a very purposeful attempt in Canada, and hopefully I can get to the end of talking about some ways in which we have formed pockets of resistance to collect data. So this is an article that came out in the Faithe, which is a local newspaper, but it represents some of the ways in which the Black community, including me, immediately could see that as COVID-19 was hitting, that Canada would not find itself in a position to provide the kind of responses to, say, the Black community that we knew needed to be addressed. Because as we could see, the lack of race-based data was has caused us to be so inadequate to our responses. There was no targeting and no way to do it within the context of the Canadian tendencies towards obscuring race-based data, especially data related to specific communities like the Black community. So this is another article where we were pushing, and essentially what we were trying to do was to get ahead of the curve, to get the press to start to put pressure across the spectrum to see if we were using all hands on deck, because what we were saying is you need to collect race-based data, and you have ignored us for a long time, and now we're going to suffer the consequences of it. We were making a point about the inequities would be left unaddressed. And we also wanted to make sure that people understood this was a much more complex issue than simple disaggregation, because in many areas they weren't even collecting it. And secondly, the questions that were being asked were not informed by our communities. So they had the risk of, in fact, and with our history of how we have been treated, there was a good chance that they would not be even in a position to collect it under the current ways in which we've been systemically excluded. So the whole issue around the cumulative effect of racism as a determinant of health, making the argument that racism in healthcare, health access, housing, etc., and really pushing for finally a variety of community-based approaches to address this. So at the end, I hope to get to this one example that I hope I can share with you. I just want to tell you that in Canada, there's been a willful refusal to collect data. The United Nations came to Canada, and two of the things that came out of it, I will share at the end, but here I want to share with you what our senior federal health officers were saying. So in a call in, I think the end of March, I was on a call with Black leaders across Canada, and I was told by a senior federal health official that Canada is a colorblind society and shouldn't expect that race-based data was necessary. Alarmingly, that was the response I got. This was repeated. There was another medical officer in Nova Scotia who said that now was not the time. Now is not the time. We can focus on these issues later. The point is that all this time is passing and our communities are not getting the data necessary to have the responses we need. And you see this lack of research across federal, local governments, British Columbia to this point refusing to collect, that's a province we're in, race-based data, and academic research continuing to be underinvested. We saw where a number of Black initiatives were not funded by the Tri-Council grants. Across the board, many of these race-based initiatives from the Black community were turned down. I know my own were two grants that I applied for to collect this data were turned down. So there's an enormous underinvestment. But we pushed across the spectrum and we started for the first time to start to see some things. And this is one of the examples of, I started sitting on Stats Canada and other places that had been in fact funded to collect data and insisting on the kinds of data and re-examining Stats Canada data to see what we could learn because they weren't putting out these things. One of the things you brought up earlier, John, and I wanted to just allude to it as I come to the last couple of minutes here, is you talk about overexposure. And for the first time, the re-examination of that issue emerged. And what we saw, if you look at the blue line, is that immigrants who are primarily visible minorities, what Canada called primarily Black and, by the way, Filipinos, are overrepresented so enormously in terms of the kinds of care aid jobs, despite, by the way, having higher levels of education that should have made them accessible to healthcare jobs as doctors and nurses, but often this is the only place they can work. So we see in this, immigrants are overrepresented. We start to see some of that data emerge. And I will end by saying one of the things I've been involved with in the Hogan's Alley Society is I've worked with the Black community here in British Columbia, a province that's particularly resistant to race-based data for Black and Indigenous people in particular, and across the board, of course, it affects everybody else. But we have been the ones that they have been particularly making sure that pushing back against us in many areas. I'm going to bring up homelessness and then I'll end. We have been involved with, this is a home, a temporary model house that prioritizes Black and Indigenous people. I'm going to tell you that the collection of this data, what we had to do quickly is this data to ensure that homeless people, Black exposed, could be housed in temporary housing was completely obscured. The system basically said to us, you have to prove to us that Black and Indigenous people are homeless. We had to formulate our community, and because of out of time, maybe there's a chance to go into how we did that a bit more, but we had to actually formulate our own community. We had to then, as volunteers, embed ourselves in the process, and we eventually prevailed, but mostly because we had to rely on the lived experience and qualities that made ourselves so exposed as individuals. Because there was no data, the data ended up costing us emotional toil. We did eventually do it, and we learned a lot about the need for communities to push back as points of resistance in data collection. Thank you very much.
Thank you, Dr. Francis. As we are halfway through the panel, formally, I want to remind folks about the Q&A function at the bottom of your screens. I see that there are, I think, 3 questions there now. Please do add to the questions if you want to ask questions to our panelists. Upvote questions that you want to prioritize or also want to ask. Thank you to Drs. Day and Francis for getting us started. Our next speaker is Courtney Skye, a researcher and policy development consultant and Catungal language student. She is a research fellow with the Yellowhead Institute, a First Nations-led governance think tank at the Faculty of Arts, Ryerson University. Courtney has led policy development for the public sector at local, provincial, and national levels. Specific focus on youth development and ending violence against Indigenous women, girls, queer, trans, gender diverse, and two-spirit people. Her work focuses on the promotion of the political mobilization of Indigenous women, queer, trans, gender diverse, two-spirit people, and youth to create transformational change in communities. Please go ahead, Courtney.
Hi, thank you for having me on the panel today. I'm here to speak to you about a policy brief that I wrote for the Yellowhead Institute. It's called Colonialism of the Curve, Indigenous Communities and Bad COVID Data. I'm coming to you from my car today. I live on my reserve. I'm in my home territory, and because of that, there's no reliable internet access in the community where I'd be able to stream. So typically I stream from my car, traveling outside of my community in order to access secure data. Starting when everyone was impacted by COVID back in March, I was following, as many communities were, the reported number of cases in communities. And around March, there was a number of reports being written, local media reports, that were talking about cases happening within First Nations communities in Canada. I live in Six Nations of the Grand River Territory. It's Canada's most populous First Nation. And I have friends, obviously, that are Indigenous and live in other communities. And one of my close friends is a public health researcher from Ganawage, which is in Quebec. And we were comparing the experiences between our 2 communities. And there was a point in March where if you added the total between these 2 communities, First Nations, it actually totaled more than the total federal reported cases of Indigenous people nationally. Even though British Columbia, which has a high proportion of Indigenous people, was impacted by COVID much earlier than we were in Ontario and Quebec. And so this raised a lot of concerns for me as a person who understands colonialism and how it impacts decision-making in Indigenous communities. And so there was a group of us that are affiliated with Yellowhead that started collecting this information on our own. We started collecting community-reported data that is available to First Nations through their bands and through public health agencies, and started to record instances of COVID data and the communities where it was impacted. And then over time, through April and into May, we quickly learned that the community reported data that was available to First Nations people was nearly twice as much as what the federal government was reporting for cases on reserve. And so at the beginning of May, we published this policy brief that spoke to this disparity in reported data. So at the time in March, we reported that there were nearly 500 cases of COVID data, while the federal government was only reporting 175 cases. And currently, the last time that we at Yellowhead did a full review of publicly available data, we had found around 600 cases of Indigenous people nationally who had contracted COVID and 12 deaths. That report was done in May. And today, or sorry, as of yesterday, the federal government has reported only 315 cases of COVID data and 6 deaths of Indigenous people. And so this is very concerning because we see the systemic gaps in data collection and how it is underreporting the cases of COVID data, and it really is undermining Indigenous sovereignty and our community's ability to mobilize mutual aid networks, to be able to respond for community needs, and being able to just decide for ourselves what responses are needed within the community. I also spoke with my own band, as we know that First Nations people are overrepresented in secure custody, and our band has not been made aware of the number of people, Indigenous people in secure custody that are our band members who have come into contact with COVID-19 while they are in secure custody, and have not been able to see early release for any people who may come back to the community. There's been almost no communication from the federal government on cases in secure custody, and it's been unclear since we raised this concern back in May if any of this has changed. So currently, the federal government is only reporting on 5 provinces. So British Columbia, Alberta, Saskatchewan, Ontario, and Quebec. All other provinces and territories are not having their COVID data made available to them by the federal government. And we're hoping that this obviously changes, that more information is available to communities. There has been a small indication that they are going to start collecting this information, in that they have funded researchers out of the University of Toronto to begin doing this work, but the amount of funds that have been made available are insufficient for a full rights-based national rollout of information and data sharing. And so I just want to end with acknowledging the Indigenous people that have passed away from COVID-19, and that we do not know how many there have been in a firm number, and that is very harmful to our communities, in that our communities are not able to participate in their normal grieving processes, and we cannot come together and to support one another in responding to the grief and trauma that is being compounded as this pandemic impacts our communities. Thank you so much for having me, and I look forward to the Q&A.
Thank you very much. Our final speaker for today is Kevonnie Whyte. Whether it is consulting with the City of Vancouver as part of their Racial and Ethnocultural Advisory Committee, or co-organizing Strategem, Vancouver's premier workplace social justice conference, Kevonnie has stayed true to her passion of working with organizations to ensure inclusive workplaces for marginalized communities. As international leader of Tomorrow's Scholar at UBC, she completed her bachelor's in sociology, where she focused on understanding how social systems intersect to result in layers of discrimination against minority groups. Since then, she has deepened this understanding through participating in systems change workshops as SFU BD School of Business Radius Fellow, and by working as a board member of the National Congress of Black Women Foundation. And now, as one of the organizers of the Black in BC Mutual Aid Fund for COVID-19. In her day job, Kevonnie is a business analyst at Vancouver Coastal Health. Go ahead, Kevonnie. Thank you for being here.
Hi, everyone. I'm really excited to be here. And it was so insightful to hear from the previous panelists, whether from, Courtney Skye, when you're talking about the discrepancy in data that is reported by your group versus the federal government, or, Dr. Francis, when you're talking about the erasure of the Black community as it relates, and the erasure of our efforts as it relates to collecting data, and, Dr. Day as it relates to the issues that the Black community are facing in the United States. It's been really a really good listen so far. As you said, my name is Kevonnie, and I'm one of the organizers of the Black in BC Mutual Aid Fund for COVID-19. And in my talk today, I'll talk primarily from the perspective of a community organizer about how our fund started, how we became involved in the advocacy for disaggregated race-based data, what we're doing now, and what we're hoping to do in the future. So first, how did we start? Back in March of this year, a group of us, there are 11 organizers in total, came up with the idea to start a GoFundMe to raise funds for Black people in BC who would be negatively impacted by COVID-19. Because off the bat, we suspected that Black people would be disproportionately affected because of a number of reasons, including but not limited to the fact that we're more likely to have precarious immigration statuses, more likely to work in the gig economy, not have steady employment, or not be eligible for a number of the federal or financial assistance such as the CERB or even EI. And over time, due to our outreach efforts, we started to get a bit of media attention. And when doing interviews, we were frequently asked to sort of validate and explain why and how Black folks were disproportionately impacted. So we took to doing some kind of amateur research, but quickly our outreach team found that it was really hard to find solid socio-demographic data about Black people in BC and about racialized groups overall. And the best and most comprehensive information we found so far was the really well-written and researched publication by the Healthy City scholar Oludalopo Makinde, apologies for the mispronunciation, which is titled Towards a Healthy City, Addressing Anti-Black Racism in Vancouver. And even this was focused only on Vancouver, not on BC overall. So that leads us to how we became involved in the advocacy for race-based data. We quickly realized that having this information would be practically helpful in so many ways. For one, it would have allowed the city and the province to be aware of how the pandemic disproportionately impacts different groups and do the work that we are essentially doing, which is providing targeted support for these groups. For us, it would also be helpful in allowing us to engage more meaningfully with the media and also target the circulation of our application more efficiently. So therefore, joining the advocacy efforts for disaggregated race-based data, which was championed by so many groups in Canada and BC, was a logical next step for our group. In fact, members from our group were present at City Council, Vancouver City Council, to speak to the motion calling for the city to urge the provincial and federal governments to mandate the collection of race-based data. And the motion was passed successfully in Vancouver City Council late last month, but we know that advocacy efforts are still needed in this call. So where are we now and what we're hoping to do in the future as it relates to our organization or group of organizers organizing this COVID fund. So when we started the fund, to be honest, we didn't have high visions. Between us, we thought that if we raised $30,000 and gave it back to the community, then we would have done a good job. But our fund got a lot of publicity, and there was an outpouring of donations last month as a result of the public outrage of the killing of George Floyd in the United States, and also the police brutality that we also face here against Black Indigenous folks in Canada. And in the space of a week, our donations jumped from around $20,000 to over $150,000. So, we're happy for the support, and I know a lot of Black organizations across North America have also had an outpouring of support, but, we do wish that this support was much more continuous and longstanding, and not just as a result of public outreach because of these incidences which have been happening for decades and centuries, right? So, and in that week too, our group was stretched thin responding to the media. We probably did close to 10 interviews and were mentioned in several websites and articles in that week. Currently, our collective is organizing to become more structured in the collection and distribution of funds. We're aware that our fund is not reaching many Black folks in BC, especially those who may not have access to a computer or the internet. So we are in the process of organizing several in-person outreach where we give money to Black folks in person, and circulating our application fund to more Black people in BC by placing posters in places Black folks frequent, such as hair salons, barbershops, and restaurants. This way, we'll also destigmatize the application, make it more accessible to folks in the community. To end, we've collected over $170,000 in donations and have processed close to 500 applications and given back over $60,000 to the community. As we become more formalized, though, a key consideration for us is protecting the data of those who apply. To do this, we try to collect minimum data as possible from applicants and have protections in place to ensure that folks who are accessing applicant information are only those who need to access it for the purpose of processing the application and issuing funds. We've also committed to deleting all information once we've finished distributing all the money. At the moment, we have not done any form of analysis on the data which we have collected as a team. We need to make a collective decision about this, and I haven't really begun looking into the resources about whether we should be analyzing this data to what end. But this talk was, especially the presentation from Dr. Faithe, was really helpful. I'm looking forward to the resources that she publishes, so we can get some guidance as it relates to this. But still, as we stand now, we're just working hard to process applications, get ourselves registered formally as a society and an organization, develop a website, logo, that sort of thing. Thank you so much for giving me the space to speak about our community organization, and I look forward to the Q&A. Thanks.
Fabulous. We are doing very well for time, which is fantastic. It gives us a lot of time for the Q&A. This brings to a close the speaker portion of today's Gender Plus and COVID-19 Teach-In. I will now ask all of our speakers to please turn on their cameras and to mute their microphones as we take questions from today's attendees. Just a quick reminder for our attendees about the Q&A function at the bottom of your screen. You can use this to upvote questions or to add your own. To give you some time to do this, I'll take the opportunity to ask the first question, which is based on one of the questions that has been asked in the Q&A. I'm not sure how we will do this in order, but I'll ask and I'll get our panelists to pipe in and volunteer in whichever order. The question is, what do justice-centered forms of data collection and curation look like? Could you speak to specific strategies and examples? We'll start there, and then there's a second part to the question.
You want us to just jump in, or?
Yes, please. Yes, please.
Okay. So what do justice forms of data collection and curation looks like? Very good question. One of the, we've had to really contemplate this in many ways, because the history of colonization, the history of slavery, there are a variety of histories that surround much of the massive data collection that we have in Canada. If you look at our census, which is a place where we put in a massive amount of investment in collecting data for, as an example, and you look at how this data, had the history of this data was never designed to create equity and equality. Now, one of the things we know is that justice demands that we have the data required, and this data then helps us, of course, to make transparent the inequities that we can then address. So when we have a system that historically has only used data to support white lives and white property, and has always privileged certain racial categories. Historically, and also inform all the questions on the survey. It becomes a really massive undertaking because, and yet in some ways it's very simple. So if you start at the level of the massive census, and if you deeply intersect what that data looks like, you find that it doesn't really ask the questions. It has never asked the priority of Black, Indigenous, and other racialized groups in this country. And it only, in fact, reflects the perception of some people. So what I say is that if you look at it from that perspective, and there are many other, including community resistance, but this one that forms so much of the basis of how we go about allocating resources in this country is based on a set of legislations, which I can't get into here, but one that I will talk to is multiculturalism and the Canadian Employment Equity Act, which is the way into the census. So we have an act here that says only visible minorities matter in terms of, and Indigenous people. But what that means is that they can put in a whole pot Black, Filipino, groups of people, and you never know which groups are actually being endangered. So it's another way of obscuring it. So the answer for me is that justice demands that we inform the whole process, that it has to be reinterrogated. We have to go back to the questions, the purpose of the census, who are included, how do we actually transform people's engagement? They'll say they engage with you. We have no idea how that ends up on a question. We don't even know it gets analyzed in ways that reflect our community. I'm answering a long time, but I'm going to stop now. But I really think it needs a reimagining at every single level to include us, to recognize the white supremacy inherent in the data and the way in which it has been collected.
I would just add from, a First Nations perspective is that we've been trying to assert data sovereignty for a very long time. This is not a new conversation for First Nations. And if you look at the development of OCAP principles, which are First Nations data principles around ownership, control, access, and possession, is that First Nations people have been very interested in controlling our own data collection methods and have been asserting that. I mean, the First Nations Information Governance Institute, they've been around for 30 years. And so there's a huge push to have accurate information that's controlled by communities. When it comes specifically to COVID and public health responses, there are very few First Nations that actually control the delivery of public health services in communities, where they would control service delivery as well as the data collection. Most are reliant on local public health agencies, and it depends and it varies on whether or not they have data sharing agreements with the local communities. Manitoba, the Manitoba Chiefs have negotiated a COVID data sharing agreement since the pandemic has started, so within the past few months. Whereas my own community, Six Nations, we deliver our own public health services. And so there's been a real difference between the information that's available to local members of my community as compared to other parts of the province or other parts of the country. And then there are other jurisdictions like British Columbia that have just straight out said they're not providing community data to the First Nations at all. And so there's a big disparity.
Dr. Day, Kevonnie, did you want to add? Okay, perfect. I can ask the second part of the question, and Dr. Francis kind of gestured to this already to a certain degree. How do we square the need for data collection and curation that is justice-oriented and justice-centered with the facts that historically such data has been used to entrench ableist and white supremacist approaches to healthcare, among other things?
Perhaps Faithe could talk to this, because I guess you have done quite a bit of work in this area. It would be great to hear what you think. I know that we are in Canada, the situation is probably overwhelming you because you actually it's your data, and I'm going to say this. Black lives were put on the line in the United States. You in the United States showed up. You showed up in the middle of a COVID, and we are all benefiting from that. So I'm going to acknowledge that and thank you, because we know that we as Black individuals in Canada, and I also know that some of the sudden attention to the hundreds of years from Indigenous people that have been absolutely ignored. Those are suddenly, at least a spotlight is being shone on them. And I do draw some connection to our brothers and sisters and what you have done in the United States and your willingness, Black and Indigenous people, to raise some issues. And we're benefiting, and I thank you for that.
Thank you. And I just shared, reshared within the COVID Black Twitter, our intersectional data call, which really draws on a lot of work and research that is happening in Canada about even the concept of intersectional data and heterogeneous data. And that's where I generally pull from. I also love that Courtney mentions kind of data sovereignty and Indigenous data sovereignty, because that's also a big part of the research that I do, and the work that COVID Black has been doing is thinking about how do you kind of integrate these decolonial understandings of data and all the work that First Nations people have been doing around these types of things. I think for me, in particular, there's an important, I think, distinction to make in terms of data collection and curation, which is this question of what is it that we are using the data for, what is the purpose of the collection, who is the data being collected for, this question of for whom, by whom, and also this question of what happens afterwards, which I think a lot about. What is the afterlife of this data, which is my largest concern when it comes to COVID-19 data. And I think particularly with COVID Black, actually on our website, and I might be able to put it in the chat, we've been kind of developing these different protocols, like data protocols for justice-oriented data collection. And a big part of it is like, what does it mean to center communities and community impact within our understanding of data? Because there are these histories which are centering institutional impact, histories that are centering numerical impact, histories that sort of leave Black communities and communities of color in general sort of out of the equation when they're doing data collection and curation work, where really the purpose is just to kind of have the information. I always talk about it as information for information's sake. We just want to know the numbers and not necessarily thinking about what those numbers actually mean. And so that's been, I think it's a big thing for me to think about, is couching our understanding of data, not just in the data itself, but what are the histories and the legacies of what that data means. When you are telling people, for example, that Black people are disproportionately affected by COVID-19 within the United States, are you couching that in the narrative of responsibility and respectability, where you then use that to blame Black people for that? Or are you couching it in a history of systemic racism within America, which is something that I've definitely been concerned about and seeing data collection in various countries. The UK is one that I've been thinking a lot about, where there has been an unwillingness. I think I like that about Dr. Francis's talk, this idea of like it's a willful use of, not collecting data is willful, that it's being done on purpose. And I think that I've seen a willful failure to acknowledge and to engage with systemic racism, even to say it, to claim it, and to state that that's why we see the numbers that we see about different things. And so I think that's one of the kind of most important, centers of what it means to collect data, to curate data in a way that's justice oriented, is to think about those histories, think about those legacies and how they're always already embedded, encoded, discursively and ideologically placed in any data that is being produced. And so with that, interrogating, why do you need this data? What is the purpose of it? How is it going to be used? How is it going to be taken up? Who is collecting it? Are all those big questions. But I'll definitely put the protocols in the chat to kind of give some more concrete ways of thinking about this.
Do folks want to add?
Well, can I just add this? You know, you put something in the chat that I think is this issue of qualitative and justice and the collection of qualitative data. When I was on one of the very first calls on COVID-19, CBC called me and asked me if I would speak to the issue of COVID-19 and the lack of, they'd seen I'd written some things and wanted to respond. And then I got on a call and suddenly I realized the logic behind the Canadian Broadcasting Corporation was to bring on Americans to tell us that Black people were going to be disproportionately affected in the United States. But the idea behind it was that we, by comparison, because that's what happens to us in Canada, we get told that we're better off than the United States, right? So that's the point of departure often. And so I was waiting on this moment, and then he asked me the very question I did not want to answer, because now I became, the data didn't matter to him. What he turned to me and he asked me was, can you give me an example of lived experience? Now you have to realize that I'm on there as an academic, and he wants my lived experience. Okay, it was early in the pandemic and I thought, well, maybe I should give this experience about my daughter almost dying at the hands of doctors in Vancouver because of her color of her skin. They underestimated what she was saying, and she literally came within an inch of her life ended. And he, listen to this. What does he say to me next? And it's in this chart. He says, why do you think that's racism? That I considered to be the abuse. But let me tell you, and so I was there, I almost answered him in the way I meant to, but it was early in the whole process and I didn't want my own personal reaction to completely take over the story, because that was what was going to happen then, because I was going to tell him exactly what that question meant to me. So this notion of, in Canada, when you don't collect data and then we have to prove it, what that normally looks like is that now we become this whole series of lived experience, qualitative. We all have to go on the line and tell our personal stories and 1,000 times over to expose our very soul. No concept of what that does to us as individuals, as professionals in spaces, and we become object A. And I'm beginning to think people actually enjoy it. I've been thinking it's almost like a little enjoyment to them to hear our pain and suffering. And so we have to be very careful and mindful that now this rhetoric has shifted. We want to hear from you about your lived experience. And it's shifted into that here. And a lot of that is, we're not going to collect the data, but we're going to make it, minimize it in some ways. And we're going to force you, we're going to force Courtney to stand up and say for herself how Indigenous people have been affected. We're going to force me, we're going to force Filipino community to stand up, and we all are some kind of gong show instead of funding research through us in ways that allow us to really collect this data. So I just wanted to address that particular point, because I've noticed a shift here in that direction.
Yeah, thanks so much for that, Dr. Francis. You really put in scope what I've been experiencing too with the media, but haven't had the words to articulate it. I've always been asked, during this, suddenly Vancouver has had an awakening to realize that anti-Black racism exists here. And we've had that awakening in the past month or so. And media have called me, and it's sort of, you kind of have to keep validating your experience. So in talking to media about the COVID-19 fund, we kind of have to, it's kind of like a show where you have to show that you've been called the N-word, or you kind of have to show that you grew up in poverty, or you have to show some other sad story to sort of validate why it is that we need additional resources and that we need additional support because we're a marginalized group. So thank you so much for underscoring that and giving me the words to articulate that.
Yeah, I want to echo that as well. It's really insidious, the way that often we are reduced to our bodies, to our traumas, rather than, the fact that we are speaking to systemic issues, analyzing long histories of white supremacy and anti-Blackness, settler colonialism, and And I thank you particularly, Dr. Francis, for spotlighting the Canadian exceptionalism that is often central to these kinds of narratives, where the kind of comparison to the U.S. Is mobilized as a way to discipline us into, taking the scraps that we do have that are offered to us in the name of kind of Canadian exceptionalism. I really appreciate that. Let's turn to another question now. Somewhat, it's obviously very related, but it has to do with how communities can be encouraged to curate and collect their own data for their own use and dissemination. What are some of the examples of that? And maybe I'll recall Dr. Francis's example earlier about homelessness and data collection as part of the work with Hogan's Alley. But before I ask you to do that, I also wanted to shout out the work that has been done by the Project 1907 Collective. Project 07 is a local group here in Vancouver of Asian activists from Asian diaspora communities. 1907 referring to a history of race riots that happened in 1907 targeting Chinatown and Japantown in Vancouver. And so making that historical connection there. But they collected data about the experiences of hate crimes, microaggressions, and other kinds of interpersonal violence to insist that what is being reported, often the most spectacular forms of violence and public ones, are not the only ones that are being experienced as a result of the rise of, in this case, anti-Asian racism during COVID-19. So that is one example for me of these kinds of community-led, for their own kind of goals, forms of data collection to speak to, silences, gaps in terms of media reporting, for example. What other ones are there that we can turn to?
I can address, since you brought it up, as briefly as I can, the Hogan's Alley Society's issue around homelessness, but I do appreciate so much. And I want to underscore 2 points. One point is that we have to be wary, all of us as individual communities, to ensure that we are not divided in order for white supremacy to conquer. One of the problems I have experienced is being put in a position where communities are actually being pitted against each other through data collection, and it's creating a situation where we are not unified. And so that's a strategy, and I'll explain it here. So here we looked at we knew from the multiple experiences we have had, and from our own community's perspective, that Black and Indigenous people would be overrepresented. Now, the homeless count had started for the first time to actually collect data on Indigenous identity, but there was no other identity that was collected, okay? So we came to the province when they were putting in these temporary modular houses, which was a rapid response to homelessness, and requested that they put in place one of these places that prioritize Black and Indigenous people, the groups that are most overrepresented. And of course, what they did to us was said, how do you know? Right? How do you know that Black and Indigenous, well, they knew about Indigenous people, so they couldn't argue, but they refused to respond to the possibility that Black people were overrepresented. So what we had to and there are a number of things they had no idea about. So they never thought of it. Right, that's the point. So they had and we couldn't get data from shelters. Nobody was collecting this data. So we, in fact, had to then start to collect homeless data. But what They then turned to us and said, you will never be able to fill a homeless shelter of 52 people. Let me just end by saying, because there's a couple of things. The community itself had to mobilize individuals to go out in their own sphere and try to collect this data. So we did it. We hadn't the experience of, I had all that resources in our hands, but we were trying to respond to a problem. So we, in fact, had to put everybody in the community we knew to try and amass. And when we came back to them, we said, we can fill this homeless shelter 4 times, no problem. There was a lot of skepticism. When we opened this home, the Nora Hendricks Place for Black and Indigenous people, we had enough qualified applicants to fill this thing more than 4 times. The point here is that we had to, as a community, form a resistance to this. But one of the things I learned in that process is that by pitting the resources between Indigenous and Black community, what they were actually kind of doing to us is saying, whoever gets the count gets the resources. Right? So all of a sudden now we were trying to work with the Indigenous community. They're, of course, the ones that were on homeless here are up against the fact that they have historically been excluded. We don't get to talk directly with the community. We were mediated in that conversation by the white supremacy institution of the city and the province. So we never got a chance to actually have this collective in terms of data collection. And so, of course, we were told that the Indigenous community didn't want to collect this data. Of course, we never believed it. But it's a part of the process. And I think what I'm learning from this is that we need to also work with each other. The Indigenous community, the Black community, the Filipino community, and various groups of communities, including putting gender orientation and a lens on this and sexual orientation. We need to make sure one of the most excluded groups are Black trans women, for example, but we will never know this because we can't even begin to find this data in Vancouver. So I'm just saying that I think we need to form broad coalitions to make sure we're working together against a system that's there to divide us and conquer.
Other folks want to engage and jump in?
Sure. I would just add that as far as like community mobilizing around data collection, when we began to notice this disparity around data reporting of COVID for Indigenous people, we started with a Google Doc. And we started collecting news articles, and then eventually over time, shout out to Nora Loretto, who was collecting data around care homes. She reached out and also supported me in the research and gave tips on how to do community data collection, and is always helpful with this work. And so we really tried to collect resources, and then we talked about it online in a very informal way, but talked about it on Twitter, talked about it on social media, leveraged that kind of internet connection that people have never had before and access to media to talk about noticing this disparity. And before the brief came out, or before this was even written, it was published by CBC Indigenous, and so they covered it as an issue on May 6th, and the federal government came with $250,000 in funding within 3 days for COVID data. So it was very much first based off social media and the small group of people that, out of interest and through our through our interpersonal relationships, that started this kind of data collection. And then as we realized it was a more serious issue, we then pulled in people with more subject matter expertise that could augment and add that like the collection mechanisms to it. So, you know, I'm not a public health researcher, but thankfully, you know, within my network, I do know someone who's doing their master's in public health right now at the University of Utah, who generously donated their expertise in helping us set up our database. So that is like how we, you know, in a very disorganized way, built organization around an emerging issue in our community, and continue to talk about it on social media and call you know, different media organizations to bring this to their attention. And there's been a lot of uptake with it and coverage, and it wouldn't have happened if it wasn't for that care of the individuals to start actually doing the work in a very volunteer driven way out of our own time, to then build a database and collect information and share that load across several different people to then call attention to this issue.
That's so inspiring, Courtney, because I think this conversation has really opened my eyes in terms of the potential that our group has, because we do collect information, but like the position we're in is that we are collecting information from marginalized people for the purpose of giving money back. So like we're very cautious about, because we know that like marginalized groups have a history of having to divulge information, having to give up information to get to receive help. So right now we're really looking for community support and resources, and aiming to see how is it, like, how do we collect information from vulnerable people who are requesting help from us in a way that sort of protects them and respects their dignity. Essentially, we're doing in-person outreach activity because we try to keep it low barrier as possible. So like when we're asking folks questions, because we do ask questions such as, do you identify as a part of the LGBTQ community, or are you disabled, or are you like a trans person, a trans identifying person, or person with disability, because we want to prioritize these people in giving funds. And in our outreach activity, we're just trying to fine-tune ways how to access information in a way that, you know, respects dignity, but in a way that is not going to put the expectation that people have to like give up information to receive help. So those are some of the things that we're like battling with, and we haven't really had the time to devote a lot of attention to it, because we were a group of like 11 organizers with full-time jobs as well. But this conversation is really helpful, you know, to give us some direction in terms of doing things like that.
I just want to recognize, and we're getting close to wrapping up, but I want to recognize, you know, a common thread that's been brought up by everyone is the fact that, you know, a lot of this work requires a lot of thought, often going against the grain of what normally is the kind of mainstream approach, right? Being thoughtful about whether and what kinds of data need to be collected, but also that this data is not just numbers. These are the, you know, lives and lived experiences and histories of our communities. Often this is emotional work, not only for folks who are offering their data, but also those of us who are collecting data. Is, you know, there's an emotional labor, a huge emotional labor component to both giving and receiving and stewarding data that is often not recognized. And I'm glad that it's been brought up in different ways by all of you. And often, you know, there's a political economy to this, often unpaid, under-resourced, if resourced at all, certainly uncompensated, unrecognized kinds of labor. And then once, you know, their value is mainstreamed or recognized, right, then, you know, often mainstream institutions swoop in to say, we're gonna do this work now. Thank you for getting it started. So I just wanted to name that and recognize all of that. Maybe as a final question before we wrap up, what's next? Whether in your own work in activism and research in relation to this issue, or just more broadly about this topic, what is next?
jump in. I feel like there are two things that are next for me. So as I mentioned, literally this week, it's like we found out that now the White House is going to take all the data from these different institutions before they release it. So I've been thinking a lot about Courtney's presentation, in part because I'm like, oh, I initially said we should probably, you know, have communities mobilize around collecting their own data. And then I feel like the push in America became, oh, well, the government will just give us the data. The CDC and all these people will just give us the data. And now that that has kind of been disrupted this week, I know that the next step for me is now kind of be a shifting focus and thinking about, well, what does it now mean to mobilize different communities around collecting data for themselves, doing that sort of work. So I'm excited to read more about how that was kind of set up. And then I guess the other thing for me is I love this mention of thinking about emotions. And I've been reading about like trauma stewardship and thinking about doing this kind of work as not just about the sort of nuts and bolts of like data collection and analysis and things like that, but what does it mean to be a better, more ethical and more care-centered sort of steward of information, and how to kind of hold space for things like racial trauma and like what that means. And so that's a big thing for me sort of moving forward, is to develop an understanding of what care looks like when it comes to data collection and curation, and especially thinking about kind of what I believe are going to be the long-term effects of engaging with this particular type of data, either as somebody who is working with it, you know, as a researcher, or as somebody who's kind of living the experience of just seeing and dealing with this data on a day-to-day basis. I think is going to be really important.
For me, I have noticed just the same way you've just said, Faith, that now, and what you also said, John, which is now that people have worked in the trenches, you know, Kevonnie, Courtney are collecting their own data, have put a lot of time and effort into pulling together data sources. I suddenly see the system in Canada starting to decide that now it's an official thing and we'll take it over for you. We'll just do it for you. And suddenly I see all kinds of researchers that never talked about race throwing in a race question. They just think if they pop in a question on what is your race, it's done. And they now have race-based data, right? And no sort of interrogation of the system, the protocol, the whole thing that we have already talked about. And so I am committed in some ways, in spaces that I am, to find the space to be an advocate for ensuring that our Black community is at the center, benefits towards that data, that our researchers don't get to just throw in a race-based data and it's done, because our numbers mean that we could be just consumed overnight by institutions that are now handling our data and telling us, we now collect it, we have it, we may give it to you, may not, but we're gonna tell you how it's gonna be collected. And so that's where I think in Canada, for me, I'm gonna focus much of my attention as we continue to reveal how hard it is to get data for vulnerable population. In particular, I'm dealing with homelessness here, and how that data, how the protocols are so inadequate. We'd have a whole session on how much violence is done to, Kevonnie, you talked about that. You think about somebody who is homeless, and now you're coming to ask them questions, and they only have experienced your questions as violence, and now and we give them no support, and then we're telling them, tell us more, we might think you're really needy, and so what is your strategy as a person? What do you say, what do you don't say? It's horrible. I can't even begin to tell you how much violence it does to people, the kinds of protocols that are in place, and they're not designed to be care, you know what you said, Faith, they don't care. There's no care in the data collection. There's no response. And so these systems of violence in terms of data go from the very top by obscuring the data or taking it over and we're putting it, embedding it in systemic racist systems that already are going to use it against us, or it completely hurt and harm the users with no real response in terms of protection. So I'm really into revealing these systems everywhere I see it.
Yeah, thanks for those responses, Dr. B and Dr. Francis. The next steps for our group, as you know, Dr. Francis raised, is really trying to hone in on, because as we're starting to ramp up our outreach efforts in person, we're aiming to partner with different community centers to be there in person and to distribute funds on site. We're trying to develop a script and protocols that will, put that care as it relates to collecting information and giving funds, and aiming to that in a way that is respectful, respects humanity and dignity. And also that's going to be just collecting the basics, and that's going to also be non-invasive. So those are the things that we are battling with. If anybody here on the call or listening would love to contact us, I'm sure I can pass on our information to Gailey, so that people, if you're able to, if you have practical experience with this and want to offer some support, we are open to having that conversation. And then also continue to educate ourselves and join the advocacy about the collection and the co-ownership of this aggregated race-based data.
I think for me, the next thing, and I think the biggest question and challenge that I've been encountering, is the idea that Indigenous people don't know how to deal with data, don't have interest in data, or that we don't have the capacity or competency to have ownership and control over our own data. And so there's been really, pushback from different public health agencies and different officials that say things like, that we can't know COVID information about our communities because it would be stigmatizing, that we would stigmatize our community members and they would experience harm if people knew in our communities who were affected. And so that to me has been probably the most harmful and insulting thing that's occurred out of all of this, because for our community, for my community at least, they did not make public the person in my community who died from COVID, but of course the community does know, and I know, and it's been shared on social media and from the family, and without knowing who the family that's impacted, we wouldn't have been able to extend care. And so while we are told as a community we would stigmatize and harm those people, the actual community response was to extend love and kindness. And so for a number of weeks after that person passed, the community was social distancing and dropping off care packages for the spouse and the family, extending kindness to them, making sure that they're able to effectively social isolate, making sure that their needs are being met. And I think that's really important, that we need to also tell the stories and the way in which our community doesn't live up to these horrible stereotypes and expectations of us, and the way that we extend care and kindness, and that a big part of jurisdiction and sovereignty for Indigenous people is not just limited to land and resources and waters. Those are very important, but it also extends to how we care for one another, and how we are able to support one another, and how we are able to solve our own problems and deal with major issues that are impacting our communities, including responding to a pandemic.
Thank you very much, everyone. I really appreciate everything that you have offered today. My sincerest apologies for not getting to all of the rich and engaged questions that have been asked in the Q&A function. I invite all of us to continue thinking about and asking these questions, both panelists, of course, and also the attendees, as we proceed from this teach-in. That brings us to a close. The the virtual collective for Gender Plus Research Teach-In. Of course, this is not the end of the conversation. As our panelists have noted, the work and dialogue need to continue. Thank you to all the panelists, Faithe, June, Courtney, and Kevonnie, for joining us today. I really learned a lot, and I really appreciate being in in community with you in some ways, in having these conversations and doing this work. Thank you for lending your time and your knowledge and expertise, and for doing the work that you do. Thank you also to our attendees for coming and for your engagement. And this session has been recorded. We will be sending the link to today's participants and posting it on various social media channels. The collective will be hosting another teach-in in September, so please do stay tuned as we work to put that together and invite attendees to that September session. Maraming salamat. Thank you very much, everyone, for joining us at today's teach-in.